Hysterectomy techniques using an advanced laparoscopy robotic system. The objectives of this video are to highlight a robot-assisted hysterectomy approach, provide an overview of the Advanced Laparoscopy Robotic System, and to review hysterectomy techniques using the Advanced Laparoscopy Robotic System. There are well-documented patient advantages of minimally invasive surgery. Robot-assisted surgery for gynecology has grown exponentially since its FDA approval in 2005 and helps address possible challenges of laparoscopy, including poor depth perception, unstable camera control, fewer degrees of freedom, poor ergonomics, and amplified tremors. Reported advantages of robotic surgery include improved visualization, dexterity, tremor elimination, and ergonomics. Robot-assisted gynecologic surgery offers an alternative to conventional laparoscopy and vaginal procedures. The Advanced Laparoscopy Robotic System was introduced in the U.S. in 2017. It consists of an open console and 3 independent robotic arms offering several robot-assisted capabilities. Its use may lead to cost reduction for some gynecologic procedures when compared to other robotic platforms. Features include an open-seated console with attached laparoscopic handles that mimic laparoscopic surgical motions with tremor filtering and improved dexterity. There is also eye tracking for surgeon-controlled smooth camera movements with zoom features and a 3D camera for improved depth perception. Instruments provide force haptic feedback, and trocar fulcrum detection reduces torque at the incision sites. Independent robotic arms are positioned through standard laparoscopy trocars, allowing for hybrid interventions. The robotic tools are also fully reusable. Limitations include limited motion and articulation, possible restriction from haptic feedback, and the size of the robotic system. This video will review robot-assisted hysterectomy techniques including port configuration, utilization of the smart camera, port hopping, and articulating the needle driver. Robotic arms are hooked up to the trocars and fulcrums are identified by the robotic system. In a triangular trocar configuration, we place our 11 mm camera port supraumbilically and an 11 mm right upper quadrant port. Putting 2 asymmetric ports bilaterally allows us to operate from each side and facilitates dissection of possibly challenging target anatomy. Using the smart camera, which moves by tracking the pupils, and the zoom feature on the laparoscopic handles, we identify the ureters along the pelvic sidewalls bilaterally. The fallopian tubes are noted to be surgically absent. The right uterovarian ligament is sealed and cut with a bipolar device followed by the round ligament. The anterior leaf of the broad ligament is developed using the monopolar hook. The uterine artery is sealed at 3 adjacent points and transected. Suction irrigation is utilized by the bedside assistant. The vesicouterine peritoneum is released, revealing the cervical-vaginal junction in preparation for a colpotomy. Similar steps are performed on the other side. The distance tracing camera feature can help highlight important anatomy, such as the ureter's course 1 to 2 centimeters lateral to the cervix at the cardinal ligament level, or help conceptualize thermal spread, which averages 2.5 millimeters. The illuminated manipulator provides ideal exposure for colpotomy dissection. The articulating needle drivers work by rolling the needle with a rotation lever, providing additional degrees of freedom. This way of suturing is potentially less traumatic to the tissues. The vaginal cuff is then closed using absorbable barbed monofilament suture on CT1 needle in running fashion, incorporating the vaginal mucosa and endopelvic fascia. The 11 mm right upper quadrant trocar is utilized for both passage and retrieval of the needle. A diamond port configuration utilizes one less port. We place 11 mm ports in the midline. This hysterectomy is performed using standard surgical technique with the monopolar hook and bipolar instrument. The 11 mm suprapubic port allows the bedside assistant to retract and surgically assist while allowing for small specimen retrieval. This port is also utilized for suction irrigation and for needle passage. Port hopping could be utilized by using the suprapubic port for vaginal cuff closure. In summary, the Advanced Laparoscopy Robotic System offers a refined, minimally invasive option for hysterectomy. Hysterectomy techniques in this video help illustrate the surgical approach.